everyone, welcome back to AstroMedic Insights, an astrology collab between myself, Jaymie from j-mescorpioaf, and a medical astrology doctor, Maria Johnson. And today we have a special guest and a special announcement. Say hi to her dog, Aurora. Hi, Aurora.
Hello, everybody. She's hiding. She doesn't want to look in the camera.
She's a Cancer rising and a Pisces sun, you guys, so she kind of likes to hide, but let's welcome her. But today we have really exciting news for a new thing that Maria is launching out. This is an amazing bioresonance program where it's a way to test for pets that's extremely comprehensive, effective. It shares so much information. It's such an affordable alternative to vet bills, which are expensive, but they can also be really invasive too. And some pets, they might have an allergy to the anesthetics, or if they're older, they don't do well with the invasive procedures. And unfortunately, just the reality of healthcare, it's a business. And so unfortunately, being unhealthy and being unwell is profitable. And so even for humans, it's hard to get to the root of really identifying what the problems are. But specifically with pets, it's even more difficult because they can't speak to us. And yet pets are just such a source of unconditional love and support. Dogs in particular are ruled by, so there's a whole thing about what part of the house rules pets and stuff that Maria and I feel a certain type of way about. But dogs in particular are ruled by Cancer because of the fixed stars that are associated to dogs. And so the other thing that's really amazing about this is that the next sign in the next house is always a resource of the previous sign in the previous house. And so Gemini is one of the signs that rules your nervous system. And the next sign is the resource, which is Cancer, which are dogs. So dogs have this amazing ability of helping us to regulate our nervous system because as animals, they shake their body when they're experiencing trauma. They don't hang on to things in the same way that humans do. So they just have such a way of regulating our nervous system. They're absolutely incredible, and they're just so loving and so sweet. And it's so important to be able to take care of them, considering what they're how much they do for us. But just in general, everyone deserves to have an advocate where they are being taken care of. And this service is so incredibly comprehensive. It's detailed, but it's also clear. It's easy to understand. It tells you, unlike when you go to the vet where you're doing a bunch of invasive tests in order to find out if something is the problem, which may or may not even be identifiable. And then when you run out of money, it can be difficult to continue this investigative journey. But in this one-off test that Maria has, it's so amazing. And the dog is put in something that looks kind of like a harness. And like one of those harnesses, like a full body harness that you put on like a pet to walk. And it scans your dog. So it's non-invasive. It's so comprehensive, and it covers just major indicators and analyzes the entire body, the different systems in your body. It's super amazing. And so Maria's going to tell us more about it.
Hello, everybody. I was just too fixated on Aurora, my little doggy. I have to perhaps give some background information. I have been having Westies since now, 34 years. Aurora is my fourth Westie. I have her since she was the age of 10 weeks, because here in Switzerland is allowed only to get your pet at 10 when they get 10 weeks old, and not before. So Aurora now is 15 weeks old. She's like a little child. She does what little children do. She's very healthy. And my previous doggy, unfortunately, she was affected from diabetes. So I was injecting her every 12 hours insulin. So I don't have to be a vet, because don't forget, veterinarian medicine is born out of human medicine. It came afterwards. Mm-hmm. I have the parameters that are shown in the device they are put lower than the one as for humans. I mean, I have enough knowledge because I have been dealing with my dogs, the health of my dogs, since ever. And especially with Tosca, that is in the other realm. I was there even more conscious because I was paying vet bills up skyrocketed. I even had eye surgery for her, and I paid in Swiss francs because I can only say it in Swiss francs. 5,000. That means perhaps over $5,000 because she went half blind, and but I wanted that she has a good life quality, that at least she can be a normal dog even with diabetes. So this device is a diagnostic device, and as well as actually preventive medicine, because if I see something, if I can recognize with the test what is wrong with the animal, then of course we can act immediately. And not, but I don't know, I want to know what will happen in the next couple of weeks, because it happened to me with a dog owner. I did the test on the dog, and about 4 weeks later she got an inflammation in the uterus. It was showing inflammation, but that was her hip. So I said to the owner that this inflammation can spread all over the body. It's not only staying in one place because it says, oh, well, here I like it and then here I will stay. Inflammation, even in the human body, they can spread. So I was very, very upset because I thought I missed something. And I always look, that is my fault. I did something wrong, and I did not something wrong at all, but I had to retreat to understand what went wrong. Nothing went wrong. The dog contracted, usually it's bacteria, the thing that she had, that the inflammation got really worse. Absolutely. But I couldn't see it 4 weeks previous because it was nothing there, because I can see when we show the list of the test, if it's a male or female, you can see whatever it happens as well with hormones, if they have any sort of allergy. And the allergy tests here in Switzerland are extremely expensive because as well it's very, very invasive. Why I do this with this device? I want to give a pet a voice, because I have been seeing myself, but with other owners, the suffering, because they cannot tell us what is wrong with them, what is hurting them. They cannot. We can just presume we make 15 different tests, and sometimes we don't even have the diagnosis. And I want that, first of all, the animal doesn't have to suffer because of these invasive tests that they have to go through. And as well, because I don't know wherever in the world, but here, especially in Europe, but especially in Switzerland, it's so freaking costly. If you go and have a vet visit, the least that you can pay is 200 francs. You don't go out less with that. But I want to give the possibility because you can scan even cats. I even had a cat that I also looked through, and thanks God this animal had nothing besides as a very strange sort of allergy, but was nothing serious. So that they have the possibility, they cannot talk to us, they can show, well, I don't feel well, I'm lethargic, but what is the cause? Because as well as a medical doctor, I am interested in the cause and not in the symptoms. You can have 50 symptoms, I don't care, but where does it come from? And that's why I decided to give the services. I have to rephrase it because I want to make sure that people say, oh, I didn't see it. And that makes me anxious, because if it's my duty to tell you, Jaymie, if I find something, whatever it is, that I tell you, and then we can act accordingly to help this animal. This is my take on it, and that's why I give the services.
Absolutely. So to kind of add to what Maria is saying, this is a really comprehensive, holistic thing. It's divided up into 17 different sections, and it covers each system and areas of your body, or different like functions of your body. It tells you about like your nutrient levels and stuff like that. And like Maria said, you know, she's really interested in getting to the root cause. Her background, most of you guys already know this, but she's a medical doctor. She's a former surgeon. She's an Ayurvedic practitioner. So she has the knowledge of acute medicine as well as holistic medicine as well. And because Eastern medicine tends to be better with chronic root cause issues, and then acute medicine is better suited for Western medicine. The one thing that I personally disagree with is, Maria, you said as a medical astrologer, you're interested in the root cause. I feel like medical doctors are generally less interested in the root cause. I mean, I think you as a medical doctor are interested in the root cause, but I think what makes this so different is that a lot of vets, they are trained in Western medicine. They're not trained in root causes. So this is something where it goes to the root cause. It looks at chronic and like acute symptoms as well. And it's not just information, but once you have this information, not only is it more cost effective, but it's more financially sustainable because you're not hemorrhaging money. And then you can look at, okay, here are the issues, and then Maria can advise you on what to do, what supplements, what medication, what diet's going to be beneficial and stuff. So you can make changes. So you're not just getting information that you don't know how to use. If any of you guys have gotten a reading from a medical astrology reading from Maria, you know that she is very detailed and she gives very useful, practical information on how you can use this information, what changes to make and stuff. So it's the same concept, like when she's very organized in the way that she presents this information. Just layering to some of the things that Maria said as a disclaimer is similar to, you know, when we go to a doctor, you know, a doctor isn't going to know, like, you know, a month from now, I'm going to have a certain health issue. It's only going to be able to analyze what's currently going on. It can indicate inflammation, but when there's inflammation, we can't anticipate where it spreads. But I think for this reason, it's actually, this test is even more valuable because we don't know where things are going to spread. When you immediately tackle it, it can prevent the spread and the exacerbation of it and stuff. But like Maria said, you know, it's only going to be able to test what's readable. But as far as what's readable, there's a lot of amazing things. And if you're ready, Maria, I'd love to screen share the tested report and like share with people the 17 different areas that this test covers.
Yeah, it says 17 different ones. For humans, I have the same machine for humans. There are 49 parameters. And for the pets, 17 are enough because you can see really the entire body. And especially because nowadays, many animals, they have really allergies. They're prone to allergies because of the food, especially the food, the water, the environment, all the toxins that are pollution, put it there. So even, but especially the dry food is not made for actually dogs.
Yeah.
And that causes a lot of trouble. Really a lot of trouble. And I'm just saying, because this is the experience through years, and I had to learn it on my cost, put it this way, because even if you talk to a vet, there are very little holistic veterinarian. This is the problem too, because they don't get it. Because if I say to you, I am interested in the course, this should be actually our aim as doctors. And our job is to tell you whatever the finding is the best solution for you and not for anybody else. Okay. Yeah. And the same thing, unfortunately, we don't have enough holistic veterinarian because they don't learn it. They don't learn it at all.
It's unfortunately a lot of it isn't available. And I have a background as a luxury house sitter and a pet sitter. And I've also noticed that the pets that are healthiest, and I mean physically, emotionally, psychologically, like adapting to stress and different changes, because when I'm there, it's a new environment. The pets that have pre-made food, and I understand not everyone has the ability and the lifestyle to necessarily feed them fresh foods, But even though dogs have been domesticated over the years, like it's still not natural out in nature to have dried, processed food. So this is going to affect the dogs. And then also there's so many rules and parameters about what is and isn't safe, and there's not enough testing that's done. So, you know, like some pets, just like humans, are going to be more resilient with certain foods, even though chemical foods aren't good for everyone. Like the first time I ever got jealous of Maria is, I don't think I told you this. She said, oh yeah, she's like, my digestion is so hardy. I could have pasta at midnight. And as a Cancer rising who loves food, I was so jealous and stuff. And I was like, that's so unfair, you know, but it still doesn't mean having a lot, like food in the middle of the night that's really heavy is good for you. And in the same way, it's the same thing with dogs. Like, you know, some might be a little bit more resilient than others, but we just really don't know what the cause is. And usually when there's an inflammatory issue, there is likeliness an allergic reaction. And then there's the whole consideration of what they're predisposed to, and different breeds have a greater risks. You know, some breeds have a greater risk of joint issues, you know, some are like different things.
With
so
breathing, for example, the one with the short nose, they usually have always issues with the breathing. There are certain
they
breeds.
can't walk for very long. You just, they
Absolutely. I mean, as Dalmatians are here, I think they have always issues with the eyes, for example. And the thing is, what the machine does is that also for the humans is a snapshot. You can see what it's at the moment. And if there are findings, of course you have to act. If there is nothing, but I don't know what will happen as well in 1 month. And by the way, as well, if I tell you, look, Jaymie, I have found this, and this, and you don't do nothing against it, well, then
it escalate. The analysis is for that current moment. And so if you don't make changes right away, by the time you make the changes, like whatever the diagnosis has been could have escalated, is really to say that. But this is still more comprehensive and more effective and efficient and more explanatory and detailed than veterinarians can show you, because like Maria said, they aren't holistically trained. And I mean, this is also a reality, not just in like veterinary medicine, but just medicine in general doesn't really focus on holistic or nutritional stuff. Like nutritionists sometimes get more extensive training than doctors do. So that just kind of goes to show you. And so many things are very segmented and stuff. So unless you have, like, one of my friends is a dog trainer and he does a lot of research on like the best foods for pets and stuff, like, you know, unless you have someone who's like really does the training, there's a lot of limited information that's available. And so this test really does a wonderful job showing you like comprehensively the different things. And I want to show you guys the screenshot really quickly. Let me just pull this up here. Let me know if you, do you see it?
with shared screen, I can't see anything.
Okay, let's see. Nope, that's the one that I want to share. Share. Oh, there it is. Do you see it?
Yes.
Okay, so I zoomed it up. Can you see the bigger zoom?
Wait a second. Yes, I can see it.
Okay, yeah, so you'll notice that in this test, it's a tested report. It shows you everything that it's analyzing. It's 17 different sections. So that's the gastrointestinal function, the digestion, the hepatobiliary function, your kidneys.
That is the liver. Hepatic is always the liver, then the kidney, the lung, blood circulation. Anyway, is the skeletal, especially for some breed, the skeletal, like the German shepherds, they have issues with the skeleton, but the back legs of the animal. Then trace element, the thyroid also is very important. Immune system, I always concentrate a lot on the immune system, because the immune system gives, even with a human, I mean, it's the same, because they are mammals like we are. If there is something that is showing that is out of range, then I'll look deeper into the immune system. Trace elements, we all need trace elements. Even dogs need they have also the vitamins. They need anything that we need. Okay, in smaller dosages, of course. Vitamins. I give as well Aurora vitamins. She gets as well from the food because I cook for her. Amino acids. Then the coenzyme is very important. The coenzyme is not only coenzyme Q12, Q10. Most people think that is only good for the skin. It has nothing to do. Even collagen. Collagen is the glue that holds the body together. Yeah. Really comes from the Latin, and from the Latin it means collare. That means it's actually gluing. And we need collagen. The eye needs collagen. The hair needs collagen. The entire system. And most people think collagen is BS, and that is only for cosmetics. No, it's not, because even if you take collagen, and it's decreasing the older you get in the human. The very same is as well with our pets. It's decreasing. They can lose muscle tone. This is called atrophy, for example. And what I concentrate as well a lot is, well, heavy metal, of course, but if most dogs I have seen, even cats, they have allergies. As I mentioned before.
Allergies.
And skin as well with dogs, because they have Westies, for example, they have a little bit special, they are pinkish. So they are a little bit delicate on the skin. If you know what I mean, I put coconut oil and other oils together on her skin, on her fur. That is helping as well, of course, the skin, because even if we put something on our skin, transdermal patches, for example, it goes through the skin, and then it goes into the bloodstream. Okay, I made something against ticks. It smells awful because it's neem oil in there. It's absolutely awful. But I added as well rosemary oil, geranium, because the ticks, they don't really love this natural herbs. But it does help, because be really careful with the ticks. It can cause a lot of harm to an animal. A friend of mine, this happened in the States. It got so bad that he got excuse me. He got so bad that he had he can't walk anymore, put it this way.
Oh.
It was a tick bite. And then, of course, the eye, or the eyes. This is very important. These 17 reports, these are important.
Are you good? Do you need to cough some more?
No, it's fine.
Okay. So yeah, all of this is really great. And these things, they work in tandem with each other. So everything is interconnected. So like, for example, like this test analyzes for heavy metals, right? And so it's important, I have a lot of heavy metal. You need to detox your body. This is affecting your immune system. This can trigger allergies, right? This can show up with skin issues. But like if your liver isn't doing well, you need to strengthen the liver. You need to make sure that the body can handle the detoxification that it's going through. All of these things are interconnected. The health of a dog's eyes tells you the health of where they're at. As the dogs get older, one of the first things to go is their eyesight. There's a lot of these different things related to your thyroid, is related to your hormones. If you're looking at trace elements and vitamins, like what nutrients does the dog have? What nutrients is the dog lacking? This can be related to maybe digestive issues, which is the gastrointestinal function, maybe isn't able to support something. So it's like maybe you need to strengthen that before adding the supplements, because otherwise the body is just flushing out the supplements. So these are all just very much interconnected, and the collagen is what keeps everything connected, so it's like, yes, the skeleton does that, but so does the collagen. And the amino acids are what make up, hi Aurora, oh, you're finally looking, isn't she the cutest, you guys? But the amino acids are what make up protein, which we're made of. So it's really important to make sure that, and I don't want to get into this too much because I don't want to get like people starting shit and stuff like that. But on a medical level, this is the danger with long-term veganism or being vegetarian when you don't have enough of the protein in your body. Like, there are things that say what is and isn't essential nutrients and stuff. But when you take away the arbitrary labels, if you don't have these certain amino acids, certain nutrients and stuff, there's certain things that can only come from animal protein. But the argument is that a lot of vegans and vegetarians say, oh, but it's not an essential amino acid. But it's like, but if you don't, category aside, if you are deficient in these things, your body is going to break down. And when you look at medicine, the reality of the matter is it's highly political, it's highly financially driven, and the political, personal, cultural interests of a society sort of there's a biases in the analysis that takes place. And certain cultures, they don't do effective testing. So even though they do a testing, it's not actually comprehensive enough in order to be adequate. And in Japan, they have done testings of like what will happen decades later, what happens. And so it is really important to make sure that you, not just you, but like your animals have the amino acids, have the collagen, so that your body, your bones, your muscles, your ligaments, your tendons don't break down, which is something that naturally happens to us. And then as we get older, we run out of enzymes, all species. And so like it's harder as it is to even retain what we have. So it's really important, especially when we're younger, to preserve it as much as possible so that when it starts depleting, we have a little bit more, so to speak. And so this is just so absolutely beneficial. And even things related to like blood circulation, for example, like you may have the nutrients that your body needs, but you don't have enough, it's not circulating in your body. So then it's a circulatory issue. Oftentimes, something that happens with humans too is that people will be like, oh, I don't have enough iron in my body. So they dose up their iron and it's not working. And sometimes it's like, it's not high enough of a dosage for you because of your metabolic rate and you metabolize things too quickly. Other times it's the formulation. Other times it's that you're leaking out the nutrients. So you actually need to strengthen your intestines and you need to make sure that you're able to absorb it, or maybe there's too much toxins in your liver, so you need to detox that because it's crowded, for lack of a better word. So there are all of these different things and so much that's going to help with this test because it'll tell you a story and they all are interconnected. So when something is off, when you understand the science behind it, something else is off. And so what's great about this is, unlike when you go to a vet where they chop everything up, so it's like you have to, not only is it like super expensive and invasive to like find the testing, the protocol is so segmented, and sometimes the treatment, they don't work in harmony with each other. But because of the approach that Maria takes, like she'll give you recommendations that is efficient and economical, because you don't need 20 different treatments for 50 health problems. You can do like 5, or don't quote me on the numbers, but this is to say that when you really get to the root of something, you actually, less is more. It's more effective. It's more efficient. It's less demanding and less taxing on your body because your body isn't having to be exposed to and metabolize a lot of different things. So that's the other reason why this is so comprehensive. It's non-invasive, it's efficient, it's effective. It tells you, what is missing, what's going on. Maria can guide you on what you can do, and it's going to solve multiple things.
You can show the other one, Jaymie, if you want. So
yes,
they can see the test result. This was only the overview of the test reports. But then each segment, it's shown differently. Here it gastrointestinal function, and here you get all the test results. And then I say, oh, okay, something is not working properly because it's in the lower part. If you see on the left-hand side, that is something not, she might doesn't get any, all the foods that she's eating, she is not absorbing it completely, put it this way. It's the very same with the human. Most people, they just eat, but they don't get the body doesn't absorb what they eat. Okay, so and the same, very same here is with the gastro, because you thought that the tested report is just the overview, but this is then the real one. Okay, this is only one segment. It goes is a long way down. Put it this way, and for the humans, I said there are 49 or something like that parameters, but this for a dog or for a cat, this is enough because it gives you the entire snapshot, because it's at the moment the dog is in this or the cat is in this health state. If it's something really that I see, you have to see a vet now to get more. I mean, if they have to get surgery, for example, then you have to go now to the vet, because I cannot do the surgery. You know what I mean?
Yeah. This is
And then
really,
this is just to let understand the audience. I am not a veterinarian doctor. I don't have to be one, because these parameters are exactly the same as for the humans. Just the parameters are set lower. But I can read for the human is, I said, much more complicated, put it this way, because there are many more parameters. But there's a one-to-one exactly the same. And I mean, I have 34 years of experience with dogs. I know how to treat them because I have been giving them myself injection, infusions, and you name it. I mean, I hope that no animal has to suffer. Really, this is my biggest wish. I don't want that poor animals, poor pets have to go through this invasive pests all the time. And at the end, you pay money out of the window and you still don't have an answer, a proper answer. Besides, if it's something really that you have an accident, for God's sake, I hope not, or if something chronic. But otherwise, believe me, I have been telling myself to the vet what is wrong with my dog. I'm just saying, because as well, they have a little bit different protocols. They have other names, but sometimes as well with the medication. Nowadays, pets have more possibility with medication that perhaps 5 years ago it wasn't. And it's more for the animal, because we have been giving the animals human medication. This as well so I mean, there are so many different aspects that we have to take in consideration, but the first thing that I want to advocate for the animal, I don't want that they suffer. I don't want that they can't tell us what is wrong with them. At least we can treat them accordingly. And believe me, Jaymie, I have been waiting over 20 years to get this machine for the pets. 20 more or less 20 years. I said to myself, I swear to whoever that I will get that machine as soon as it is out, because I want to help the pet. First comes the pet, and then of course the pet owner. I want to avoid them too many costs for nothing, because I went through myself. I know how it is. You just give out the money out of the window and you don't get any diagnosis. They do, even if you have to do an allergy test, believe me, they will actually put needles everywhere. They put out on whatever, and it does hurt. It's very cost intensive, really, very, very expensive. And perhaps 4 weeks later, you get a result.
Yeah, I mean, and it's really unfortunate, because the reality of the matter is, if most people don't have unlimited cash, we just don't, So unfortunately, and it's so hard to pin down and identify what's going on, it's an unfortunate reality that when you run out of money, you run out of tests in order to find out what's going on, even though the test, the way it's structured, isn't really designed to properly identify what the actual issues are, which makes this test so useful. And it's also, even without having a medical background, this is something that even if you don't know about some of the stuff, which is why I broke down the details with the tested report list, the 17 different things. You can even Google it and get this information. But in this, so this page that we're looking at right now, this is just for the gastrointestinal function. Each section has a page like this. We just want you to see a visual. And for those of you guys who have gotten tests from like Quest Diagnostics for humans to find out what your, if like, do you have any infections? It's a very similar range. And you'll notice that it's color coded on the right-hand side. And on the bottom page, it's a little bit cut off, but you'll notice the different indicators. So, you know, this is just like the color understanding that we universally know, like green is safe, red is bad, you know. The blues are when it's mildly abnormal, and then the yellow is that in-between range between, you know, it's like it's not quite red yet. It's not like, oh shit, but it's getting there. And so you ideally you want to get to that center of that green. So with this test, you'll notice that like the first arrow, the marker is that's on the yellow side is for the small intestine. So that tells you that there is a digestive issue that's going on. The other one is colonic absorption. So this is to say that there's some issues going on in the colon. So it's, you know, it tells you the areas where there are challenges. So you get to target exactly what area to work through. It tells you the ranges that are the best and what the actual range of your pet is. And so there are numbers, but there's also visual cues too, which makes it very visually easy to process and understand what's going on.
What I wanted to add, Jaymie, this is fine. Sometimes it's even more than one page for each segment, okay? But the thing is, even when I do for humans, I have to figure out what the cause is. Yes, it's showing me all these beautiful colors and this and that and the other. I see, well, something is with the digestive tract is not working properly, or the absorption. Then I have to, because I said before, I concentrate a lot on the immune system. So that means the absorption, it might be perhaps some enzyme are missing. It can be as well that you have to give the dog probiotics, or even for humans, or pepsin is missing. I'm just saying, I have to figure out, because yes, I see the report, I see the results, but I do a synopsis at the end. All the time I do a synopsis, and I try to figure out where the cause lies. You know what I mean? It's not just this beautiful yellow. I concentrate as well always on the yellow. The blue is something that is, it might be, but it's not really.
It might be like an acute environmental exposure that happened. Yeah.
But the yellow bulks, they tell me, here you have to act. Here you have to do something. Because I even told the owner of this test with for the dog, I told her, yes, I know she's cooking, but I said, most likely she cannot absorb because she has missing this, and the other. Okay. And then if she didn't want to add on some probiotics, even quark is very good for a dog. You can give quark. Quark. It's called quark. Okay. It's not yogurt. I know I'm not very fond of yogurt. They like even cottage cheese, for example, but not all of them, because they can have a milk intolerance. It's not the mother
just
milk.
Like humans.
It's exactly like
lactose intolerance.
So I have to be careful when I read these reports, and I make a synopsis to get out the best for not for the client, but for the dog, because the dog is my focus. The client, yes, is the owner, but I want to help the dog or the cat. And in this case, unfortunately, she didn't want to make big changes. I said, you need about 3 things for her, because when I did the synopsis.
Well, shit, no wonder why the problem escalated then. You didn't tell me that part.
And then it did escalate because I was really so freaking upset with myself. I said, I did everything wrong. I didn't see this, or I didn't miss that. And
you're not
I really
responsible for the dog owner's decision over what they were going to do with their pets. That was on them.
I said, she needs only 3 things. Please do this, this, and this, because the malabsorption, she doesn't get all the nutrients out of the system in where she needs it. And by the way, yes, she has this on the hip, because I felt it was hot. I didn't even do acupressure on her. because you can do as well acupressure on the dogs. And I said to her,
guys.
I do that every day as well, or massage properly. Aurora gets it daily, I don't know how many times. We have our fixed hours as well. And she lays there and she says, okay, here is my dummy, please massage. So
she's like, I'm ready.
Yes, here I am.
You little brat, you.
And things like that, they're very, very important. That the owner is aware of it. I had another woman. It was freaking hot. We had about 36 degrees, which is very unusual for here. And it was sticky, but she took the dog in a bag for winter. And then she says, well, he can't breathe properly. Of course, the dog can't breathe properly. If you take him in a hot day in a bag, which is actually for winter, how the heck is your... And then, of course, you have to cool his neck. I gave her, how you call it, a towel. I said, I don't give a shit, excuse my term. But the dog feels hot. That's why we have to cool him down. I put it around the neck and then the rest on the entire body, especially on the back. So the dog cool down. They have the same issues as we have, for God's sake.
Yeah. It's the same thing that they teach you in Chinese medicine. You release a lot of heat in your head. So when you're cold, they say keep your head warm. I think it's like 30% of heat gets released from your head. And then when you're hot, you want to cool the back of your neck and stuff. And then dogs have fur. And that's one of the things that's so annoying, is that pet parents don't realize that. Or if you're walking and it's like, because I mean, you live in a colder environment, but like I was living in LA and now I'm living in Bangkok. If as human beings, we walk barefoot and it's hot, it's going to be hot for the dogs too. So sometimes they need booties and whatnot. There are different things that you have to consider. And sometimes I think pet parents don't think about these things. And I remember I had this neighbor who was really thoughtful, and she went into we went somewhere and then we got into the car. We were walking our dog and then we got into the car right away. And she started driving and she was like, oh, can you take the harness off my dog? Because she wants to make sure that her dog is comfortable, thinking about it from the perspective of like, would you want this? Like thinking about those things, try to put yourself in that perspective is really important. But like Maria said, you have to take you have to do the protocol in order for it to be effective at that particular point in time. So that's really important. And, Maria brought up a good point about like the blue isn't really something that she's as concerned about, because that's like kind of like, life happens, like if it's hotter or I'm stressed out, like just like with humans, we might have some slight elevations and whatnot. And I can't prove this, but like as a pet parent, when you were talking about like the skin, being a little pink, is something that I noticed particularly, and I'm extra cautious about this with dogs who are anxious, is that I always like try to lift the fur a little bit, and try to see like the complexion of the skin, because if it's a dog that's prone to being anxious, they do get a little bit pink the first couple of days. I mean, I don't necessarily, what I always do is I show up before the pet parents leave. So I'm observing the dog. So I have a visual cue, and I don't like, sometimes I take pictures, so I have a visual reference, and I look at the color of the skin. And then the next couple of days, when it's just me and the dog has a lot of anxiety, they'll go a little pink. And then after a while, they regulate, because there's that like inflammation, that anxiety. And then once they feel comfortable, they start to calm down. So you do also have to consider the baseline of your pet. But when it starts to escalate to like the yellows and especially the reds, it's like, that's a problem. But the key is that you want to stay. Like that dog did considerably well. Like most of it was in green. It was only 2 things that were in yellow. That's pretty good, But like,
I'm just saying, we have to be aware of, like the human. They are mammals like we are. So if you feel hot, I would never ever think of leaving my dog in the car in the summer. Am I completely mad or what? Not even a minute. Even if you have air condition. So I go out with her in the morning very early, say, because we really had hot weather. 36 degrees here is like having 50 degrees in another country. And perhaps then at night, look, I know many people don't have the time or the money as well to cook for them. And this is unfortunately the food, the animal or pet food is not really what they tell us that is written on the label. Believe is exactly the same as for humans. That's why I rather cook myself for her. I add on vegetables, whatever she likes, because she likes she loves carrots. She has, I don't know, a weakness for carrots. Then she shall have carrots. I put us as well green inside. She loves lentils. When I cook lentils, she smells it. It's anyway good for her as well, because lentils has a lot of iron. And I make a little bit more, like a broth, and she will get it unseasoned for her.
I feel like in Ayurvedic medicine, I'm gonna guess that Aurora is probably Vata, right?
Yeah.
So lentils are good for that.
Vata, she loves it, and I mean, she can have it. Just what we should look, what we eat is exactly the same for them. And but the very little stupid things, as I said, if we feel hot, we can sweat through the skin. They can only sweat through the pores and through the mouth.
Yeah.
So it's not through the skin.
Yeah. So, and especially dogs, like you'll notice when they get hot, they're panting, their mouth is drooling, you know, that's their way of cooling down. Like, and so you have to learn the difference between, is it anxiety? Are they excited or are they hot? You know, and this is where also like brushing the dogs can be really beneficial, because then you start to realize like there's more fur in the wintertime, there's less fur in the summertime in order to cool off, you know. But if you're not like monitoring their hair, you're not going to understand these things. You know, like Maria, she's had pets her entire life. I didn't grow up with pets, but I've been a professional pet sitter and stuff. So I've come across a lot of like these experiences. And something I want to add to in regards to what Maria was saying about the pet food ingredient. And I also have some advice for you guys too, to like make it easy to make like home cooked meals for them, which is actually easier than getting like the processed food. But the way the health food industry works is that until an ingredient is proven as being harmful, which is expensive legal fees, lots of tests, you need to have the funding. And oftentimes when someone goes to try and fight it and they're like, this is a problem, they usually get bought out. The company who is actually putting something that's harmful will bribe the judge, and then it ends up continuing to get circulated. But there's also not a lot of funding to prove what is and isn't actually safe. So there's all these different things. And I happen to have friends that are not necessarily friends, some of them, but I know this one attorney. I'm trying to think. I'm like, should I say this? You know what? Fuck it. I'm going to say it. I know an attorney who gets drunk and would just get really mad and start admitting to me all these like companies that are like in the middle of a settlement, and then they get bought out. And then like now the information isn't available. So I have legal information that I'm technically not supposed to know. And it's like all of this information. So there are things that I'll tell my friends like, hey, you need to be careful with that brand. And I've also worked in promo and marketing, and I've done lots of promos for both like humans and pet care. And they'll have things, they'll be like, oh, so this batch had mold in it, but it didn't, and it got people sick, but it didn't kill and get enough people sick, because there is a quota. You need to get enough people sick. And sometimes not enough people got sick because not enough of that batch got distributed. And we were told, just refrigerate it so it'll be fine. We're going to be in the dead of heat. This is going to get people sick. Like, and I got mad and I quit and stuff. And this was like an important, like, this was a good company. And they had like stuff for children, and the sister company was fine. The other one wasn't. So you just never know the shit. Like Maria and I, we have a lot of like insider behind the scenes information that we're not even like sharing. But we're not just saying like, you know, like you have to do this. Like we're realistic about the reality of limitations that exist, you know, because Maria, she spoils the hell out of her dog. She gets multiple massages a day and, you know, like gets fed food. And, you know, most of us don't have the resources or the stamina. Like I'm a pet sitter and I can't do, like, I'll crash out, you know. You don't have to go that hard, but a lot of things that are really good. And it's so funny because one of my best friends, she has like a lot of like health issues related to like a reproductive system, and she just needs more animal protein in her body in order, like, a lot of people think that animal protein, because it's acidic, is going to have health issues, but because our body, because the protein is made out of amino acids and our body recognizes it, it actually helps to restore our body. So especially organ meats are really helpful for humans and animals. And I was staying at her place at one point when she was out of town, and I saw this like food packet, and I had no idea it was for dogs. I was about to call her up and get mad at her and be like, why are you not eating this? This is so good for you. This is the one where her boyfriend is a pet trainer, and it's got like the you know, it had meat and vegetables, it had different organs, and it was like, I mean, the ingredients, I could have eaten it. And I almost hit her up to be like, can I eat this? But then I realized, oh, it's for dogs. So I didn't touch it. But the best foods are like that. And one of the things that can make it easier, because honestly, sometimes pet foods aren't cheaper. And if you get meat on sale and stuff, like, just get a slow cooker. You could be really lazy with it, you know, and just put all the food in there. You want to make sure that it's thawed, because if it's in a slow cooker and it's cooking at a low level, you know, you want to make sure that it cooks thoroughly and evenly, which if it's frozen, it can't necessarily do. But like, you can literally get a big bag, throw in the frozen meats and the veggies, put it in the freezer, just do it all at once. It'll take less than like 10-15 minutes, depending on how efficient you are. And then every few days, just take it out, put it on your calendar and stuff, so it's defrosted by the time you need to cook it, and you put it in the slow cooker, and you literally just add some water to it, and it's veggies, it's meat and stuff. You feed the dog, they love it and stuff. One of my friends, she's a nurse. What she does instead is she cooks everything on the stove in huge batches, and then she puts them in separate Tupperware and stuff. And then, you know, microwaves aren't the healthiest, but it's better than feeding like dog food. She just thaws it in the microwave and then feeds her pets with this, you know. And so it's stuff like this where it's actually less effort, and you can go to your grocery store, talk to the butcher. What they do is, like, in order to get a new inventory, at some point once a week, they drop the prices of the meat. It's still fresh, it's still good, it's just not as fresh as it used to be. Go there and ask them, when do you have your sale days? Get that and make a bunch of food ahead of time. There are so many different ways to do this. You know, if you're not great with this, maybe invite a friend over and be like, hey, I'll buy you some food. Would you mind doing this? You know, I've had friends come over and ask me to do that, and they just, because they don't like to cook, so they always order food, but they want good food for their pets. So I'm like, I'll cook the food, and if you want to buy me some food, like, we can eat. I mean, you know, there are things where if you do this, like the way my friend does it, where she puts them in like single servings in the Tupperware. She does this once a month. Actually, no, she does it several months, because she ended up getting an extra freezer. You know, the slow cooker method is super easy too, you know? So like, there's this idea that dog food is more convenient, but it's actually not, because it causes health issues in the long run. And it's expensive and it's heavy. Even if you have the food delivered to you, they come in huge portions. You know, you got to make sure to hide it. You got to store it, you know, because some dogs will tear through. Like if you have a German Shepherd, you know, like you need to put that in a container. You need to put it high up, you know, like I've had situations. I'm short, you guys. I'm 5'2". I have to go up a step ladder and the dog is trying to like fall over. Like I've fallen from step ladders because they're so excited about the food. I need to throw the dog into another room and stuff. And during the time that it took me to get a stepladder to reach the food. And I know that this isn't everyone. The dog tore through the carpet because they were so hungry.
Oh my God. Oh
And,
my God.
they're crazy. So,
Yes.
Not everyone is experiencing stuff like this, but this is to say that dogs also do really well with a cyclical schedule. They do well with consistency, So when you have something on rotation like this, where you're cooking, where it's easy to do, they're also going to feel this sense of security, this sense of routine and stuff. They're going to feel taken care of. The food is healthier, so they're going to be healthier, but that routine is also going to give them that sense of safety, and that's going to help them to be more calm and collected as well.
What I wanted to add on food, I have not given it to Aurora because she's a little bit too small. I have changed now that she gets meat, because it's at the age that she can have meat. And the power food, number one power food is actually beef liver.
Yeah, they love a beef liver.
They love beef liver, and it's anyway a power food for the dogs.
It's literally nature's multivitamin. Also has minerals too, but this is the multivitamin. That's what they call it.
Absolutely. Yeah. So it's important when he is, when she is old enough, I will start as well with beef liver, because I want that she gets everything out of the proteins, whatever she needs. Purine is part of the meat as well. It's called purine. We need it, even we humans. It's part of the protein chain. And if you want to do something good for your dog and is old enough, out of puppy age, put it this way, you can give beef liver as a power food, and you can be sure that it really helps your dog with being healthy. Because my grandfather used to have hunting dogs, because in Italy they were hunting, and one of his dog was called Stella. I had actually myself a Westie called Stella, in memory of the dog of my grandfather. And Stella died at 20 years. But what were they getting?
That's a long time for a dog.
Yes. But my grandmother, she was cooking. She had, the huge pots, the old huge pots. She was putting vegetables, bones, everything, potato, whatever it was from the kitchen. And that was only for the dogs. And they were so healthy. Not like nowadays, because it's like a chain reaction, exactly the same as with the, humans. You get this, say you get a medication. Yeah, but what is the interaction from the medication with another one? And then you have this, how you call it in English, vicious circle. But you have to try to figure out the adverse reactions, and they hate each other.
Yeah.
And exactly the same happens with our pets. So also be careful what to give them as medication. And just to put it in the book as well.
So this is actually something that I want to talk about, because with humans, okay, it's the reality is, unfortunately, and Maria, you can attest to this, most doctors don't really have a training or an extensive understanding of pharmacology. And I worked in the pharmacy department. And so, I can't tell you how many times pharmacists save patients' lives because they're like, you cannot give this formulation to a newborn. They're going to fucking die. It's really upsetting and stuff. Yeah. And so pharmacists literally keep people safe. So when you go and see a vet and they give a medication, I want you to go and Google that shit, contraindications, all of that stuff, because you will be amazed how many of them aren't familiar with this. One of my primary care physicians was one of the few people I actually knew, doctors in France, who said that when their patients moved to the US, they were like, good luck, but I'm not going to take you on as a patient anymore because American doctors are stupid. This was the only doctor that French doctors worked with. And he used to, on the weekends, go to school to get pharmaceutical training. And he said
it's because private lessons.
Yeah, which you
biochemistry. Yes,
Exactly,
because
yeah.
it's too little. Say, for example, I take blood thinner. It's normally heparin. And
Yeah.
say somebody would give me aspirin, I would disengage
Yeah.
because it's already I'm already taking blood thinner. So if I take aspirin, I would die. I will really disengage. Is
Yeah.
the medical term. You would lose so much blood that you say, okay, I don't have blood anymore.
So Maria and I, we do monthly medical astrology calls on Patreon. They're very affordable. It's a monthly membership. Everyone has access to asking one general health question that we answer. Right now, though, like as like we don't have too many subscribers, you might be able to ask multiple questions depending on the time. I'm going to be careful in saying that, but just the nature of Maria and me will probably ask additional questions, so you'll get a lot of feedback. But we were covering this in the last call that we did on with Leo risings, where a lot of Leo risings have dramatic health issues. And so like when you have the inflammation, it's a really common, when you have health issues, your body is inflamed, it's really common for people to be like, oh, I'm going to take an anti-inflammatory. None of the anti-inflammatory medications fucking have a warning saying you cannot take this with aspirin, which is so upsetting to me. There's a lot of stuff where they don't tell you, they don't put down contraindications. In that video, Maria did tell us about a natural anti-inflammatory, which isn't a blood thinner, so you can check that out. But this is to say there's so many different things. And like Maria said, there are contraindications and stuff, but there's a lot of information that people aren't familiar with. I don't have as much extensive experience as Maria does when it comes to medication. Like I have worked with pets where I had to like give medication and stuff, but I don't have the understanding of like what was given, why it was given in the same way that Maria did. I always did the research for that specific case, but I don't know enough about veterinary and vet pharmacists and stuff, because when I had a dog that ended up getting sick, which was inevitably going to happen because the dog was like really like sensitive, and the dog was overly sanitized, and then the pet parent wanted me to follow a protocol and then didn't want me to because she was running out of money. And then it's like, well, of course your dog got sick. Like they're sensitive to toxins because you over sheltered them. And so I went to pick up the medication, and it was at a regular pharmacy and stuff. So I don't know how familiar pharmacists are with veterinary stuff, how different or how similar it is and whatnot. So, but for that reason, everyone should do their research, but especially for pets, you need to do your research on the prescription medications, because you just, there's less information on contraindications. I've done some research on it, because I've worked with pets where the pet parents are like, they can't eat this. Sometimes they can eat that, or this is safe. I'm like, well, I'm not touching the maybe foods because I am a new environment. They might be more hypersensitized. I'm not going to risk it, so I always pick the safe things. But there are so many different stuff, and like, this is a general analysis, like it's not 100% in every case, but generally the healthier the dogs are, the more they do well with certain types of fruits, for example. Like some animals that are super sensitive, they can't do certain fruits, but that's because they can't digest it, or there's something going on. Yes, certain breeds have, certain restrictions, yes, but the healthier, just like with humans, the healthier we are, the more we can eat things and the less we're going to have adverse effects. But it's one of those things where it's like, I'm not judging pet parents for not being able to cook, but the reality of the matter is, and I think this is something people don't realize, cooking for your pets are actually easier than actually buying pet food, because then you got to package it, you got to schedule it, you got to carry it over. It's actually easier to cook from scratch. You just have to find a system, and it's way simpler, you guys. So that's something, it's just a matter of finding what actually works. Some dogs do really well with like sweet potatoes and blueberries, for example, and these things are really economical. If you make friends with farmers, they tend to have an overstock of food, so you'll get a bunch of free stuff. And especially when you get farmers that love animals, I know this one farmer whose wife always gets mad because he always brings home like new pets and stuff, and his wife is like, no more. And then she shows me the videos, and it's just like, isn't this dog so cute? And he was like, she was cussing me out last week, and she said that she was gonna put me up to pasture, and she was gonna find a new husband that isn't gonna bring new like cattle into the house, but she like loves them afterwards, and they're such animal lovers. And when you tell them, like when I was like, oh, I pet sit, they're like, oh my god, and they're like, what food do they like? And they gave me extra food. You know, it's actually like it's pretty easy, like especially if it's like they do sweet potatoes. You can boil a big bunch, put them in Ziploc baggies, put them in Tupperware. You know, it's actually a lot easier than you realize.
Absolutely,
So
I do the same.
Yeah.
I mean, we are not here to judge anybody, Jaymie, because if they want cook. This is just a general thinking loud of what normally happens, because this is life. And to be more aware on how you can look after your pet. This is that nobody's here with a finger pointing and you don't do this. Don't forget, 2 show to you and 3 so back at me, the fingers. I'm just saying, it's just to give some tips, some thought, because I went through hell with my previous dog, and I don't wish that to anybody. Really, I don't.
Poor Tosca. Yeah. And the thing is, you know, we all come from different financial economical backgrounds. And I think that if you're a good pet owner, everyone should be able to have a pet if you have a safe place for them, you know. And it's one thing to be able to feed and keep a pet alive. It's another thing to be able to afford pet fees, because dogs are inevitably going to get sick. And it doesn't matter how sick they are or how not. It's just designed to be so expensive. And I don't like the idea of, we all do so much better with pets, or a lot of us do. Like, I want people to be able to afford their pets, because unfortunately, like, you know, Maria, she's a doctor. She makes a little bit more money than most people, you know, but she was even still financially having difficulty. And it's like, you know, it's like when wealthy people are financially struggling with the cost, that makes it really inaccessible and unfair for the rest of us. And there's so many pets that in shelters, you know, like people want, like, I wish we lived in a world like that we can be able to make these things more accessible. Like, you know, I've always been asked, why don't you have pets? You're so great with pets. And I'm just like, because my finances are very cyclical. And I don't want to be in a situation where something happens and I can't like take care of my pet. Like, I just don't want to put a pet in that situation. So, you know, but this test makes it so much more accessible, you know? And so it's like, you don't have to have some unexpected health issue show up, and then you need to find the money that you didn't save up for. And then there's all these like added on fees that you didn't know about. You know, this test, there is a flat rate. It tells you everything, you know, depending on what the findings are. Yes, like there's going to be a budget that could be greater or smaller, but once you know the cost and what you need to get, you can calculate those expenses in a way that's much more attainable, essentially.
For example, I had the dog that had issues with the breathing because it was too hot and that I cooled down. They wanted to do, they recommended a test, a CT scan, but the dog is already a little bit too old, so it would be risky, and especially the breed, to do a complete anesthesia, total anesthesia, because I told them, if you do that, you risk that the dog dies. Honestly, I would not do anesthesia, full anesthesia on your dog that has already health issues. And you know how much they wanted? They asked 1,700 Swiss francs for one CT scan.
And then there's going to be some other issue that they're going to have to do. That's the other thing, is that you never go in and just do one thing. And then the other thing is, the doctor that I was telling you about that I really liked, I went in there and I told him, I was like, listen, I've been going to the doctor for years. I haven't been able to solve the problems. I've had so many testings done. What is the most cost-effective, strategic test to take? And then he said to me, based on your symptoms, the protocol is to give you these 5 tests, but let's start with these 3 tests. And he was like, actually, let's start with 1 because that could potentially eliminate 2 to 3 other tests. Now, most doctors don't think like that. Like, don't get me wrong. I'm not saying that doctors aren't smart. You guys are obviously very good students, but there is a huge difference between being a good student that can memorize information and actually being intelligent. Like, they're like especially like doctors are trained to be diagnosticians. So it's like they give you a robot brain and they're like, this is symptom, you do this. This reaction, you do that. And a lot of doctors don't know how to think outside of that. So a lot of times they end up saying you need to do all these tests because that's what they were trained to do. And it's not actually necessary. But a lot of them, they spent years in a sedentary environment where their brain is being fatigued. They're not trained to think independently. They're just consuming information. Like, it's a miracle that Maria turned out the way she did. You know, like,
well,
her rebellion just didn't retain, like she had to do her own thing, you know?
Thanks God, well, I am old school, but perhaps I am very curious and I want to know more because you learn very limited. I told you more than once, I have a physician in my family, and one of the old physicians that when I was ill as a child, he's the cousin of my grandmother, he was looking after the entire village and even other villages. He was a little bit crazy, but you know, he was an absolutely brilliant doctor. And he was looking at your fingernails, he was looking at your teeth, he was looking at your tongue, he was looking here if you had anemia. This is old school. I wonder, and sometimes I even tell to especially to my son, I feel ashamed about my profession because I wonder what the heck do they learn nowadays? It's not always.
I feel ashamed of your industry too, and I'm not even a doctor.
I mean, it's not. It should not be called health industry, but it's sickness industry.
Yeah, that's true.
Because we make my job as a doctor is not to keep you sick. My job is to help you to get healthy, but that you remain healthy. Exactly the same should be with veterinarians. You don't need all these tests. You take one. For example, if I do the blood test, say I want to do a blood test. I say, okay, Jaymie, listen, I want the big, because there are several blood tests. I want the big complex blood test. So you don't have to do the other 4 tests.
Yeah.
And you have to pay, I don't know how much of your own money. This is what is making me angry. Why on earth can't we help the patient to get, as I said, healthy? This is my job, not to get him after 3 weeks. You come back to me and say, well, nothing has changed, really. Of course it didn't change.
People spend more time with their doctors than their family. And, you know, like, one of my friends, it's not his fault. Like, he like has a breathing thing and they don't know what the problem is and stuff. But like, his doctor is like, I don't want to keep seeing you. And he was like, no offense, but I don't want to see you either. And it's like, the key is to see your doctor as least often as possible. That is the goal.
Absolutely. Yeah. This is my goal for you. If I feel, I mean, even if I had something, it happened this week. I had, I think, food poisoning. I know how to handle it, of course. It's annoying because if it, I have no strength, nothing, I can't eat, I can't breathe.
That's how I feel. I'm so dramatic when I have food poisoning, and I get better every day.
I'm just saying, I'm only a human as well, but I want to get myself on the feet again and say, okay, I don't want this BS. I want to get out of it as fast as I can. Of course, you have to give the body a couple of days to readjust. But afterwards, you try that, or you avoid that nothing again will happen. Exactly the same should be with the patient. My job is, as a doctor, as a normal should be doctor, that we recognize what you have, but that you get healthy again and you remain healthy.
Yeah. And this is something that everyone deserves. Not everyone has this, unfortunately. Thank God we have the internet so we can at least like share information, you know, about health and stuff. If you are new to my channel, I'd love it if you subscribe. Marie, I have a playlist specifically with the videos that Maria and I have done. We have a really extensive video. I think it's like almost like 3 hours or maybe longer, where we talk about the 8 components that make up the immune system. It's super comprehensive. So definitely check that out. With this particular test, hi Aurora. Sorry, you might want to talk because I want to play with Aurora. But anyway, sorry, let me try to focus. With this test, because the dog needs to physically be there and it's a machine, it's a bioresonance machine, you do have to physically go to where Maria is at. Just like when you go see a veterinarian. Maria does live in Switzerland, right? Yeah, Switzerland, in Cloton. So you do have to go visit her. This is obviously going to be easier for those of you who are in Europe because it's easier to get around and stuff, or even like Asia. Like once I left the US, I was like, wow, it's so easy to get around. Like in LA, you have friends that live 5 miles away. You're like, it was nice knowing you. You never see them again because traffic is just so bad and it's crazy. But then you come to another part of the world and it's so easy to commute. But even if you're in the US, if you can find a cheap flight, which is especially common to US, like they have a lot of economy, luxury, what do they call it? It's like the first class luxury flights and stuff, right? Is it like honeybee? I can't remember what it is, but like they have really, really good deals. A lot of them, I think, are to France. So I don't know about Switzerland, but if you can get somewhere and then find a train, the trains are also really for your dogs. But let me tell you, it's going to be a lot fucking cheaper if you can afford domestic veterinary bills, you can afford to go visit Maria because it's going to be cheaper. Believe it or not, it's not going to be cheap. Plane tickets still cost a lot of money, but even then, sometimes these luxury economy flights and stuff, there's new ones that get created, and then they have promos, or sometimes they get like a business will relaunch a new name, and they market themselves as a new company, but it's like the same company just being renamed. And then they want to have a good reputation, so they do all these nice things. So especially flights to Europe, they're a lot more affordable. They have all these specials, and it's actually these luxury economy flights can be cheaper than regular economy or business flights. So check that out. I have another recommendation for you guys because I'm really jealous because I'm not there. Maria, she's crazy. Okay, if you don't know this already, and she like makes her own supplements, and she packages like thousands of these like pills, like and capsules, yeah. And it's like, it's so insane. And sometimes she'll talk to me and she'll be like, oh yeah, I'm so tired. I was up till 2 in the morning, whatever time it is, just packing these pills. I'm like, oh my God, that's insane. But she makes these amazing pills. She gets them from some of the best places. She knows the manufacturers, they're super clean. So, and she also tinctures and dries her herbs and stuff. A lot of people, even when you go to tincturing classes, which I've been to, they don't understand the solar cycles of when to extract things, how much, you know, all these different stuff. There's certain things you have to extract it at a certain time. It needs to be out in the sun in order to get the nutrients. Like certain things that are good for like the winter time, it's because there's deficiencies that you don't get in like the spring and summertime. So they need to be out absorbing that energy. And there's all these different rules and stuff. Maria does all of it. And so when you're there, I encourage you to ask her about the supplements and the tinctures that she makes, you know, just because I think it's so fascinating, whether you get them or not, although I totally think you should. Like, she's so impressive, and, you know, she loves to educate you. So it'll be literally impossible for her to have a conversation with you about this without you learning something. You might want to record the conversation and stuff. You'll learn so much, and I highly encourage you to do that, because that alone will give you a free medical lesson.
for example, as talking about herbs, especially now, the time is to get, for example, it is in the field, St. John's wort, okay, the plant, Hypericum perforatum, it's called the botanical name, and that is actually to be used in the winter. But you have to have a sunny day and to actually pick up the flower, the plant as such. I have a farmer. He calls me before he's cutting whatever, and he says, "Do you want to get your plant?" So I go and pick that myself, but I have gloves on because otherwise I will be have stained hands because of the color. It's getting so rusty, the color. If you know St. John's wort, and I make my own oil. But you have to, first of all, to get the plant, then you have to dry it, then you have to give. I put it in copper, in a copper container, and I leave it there for at least 24 hours. And afterwards, I make either capsules out of it or I make oil out of it. Depends on. But I have oil, and the color is really so dark, reddish, rusty.
Yeah, it's a gorgeous, vivid color.
And that you should take actually in the winter because it's light sensitive. And all my products, they are just put in amber glass bottles. I don't use anything else. I just use glass.
Make sure they don't oxidize. So I don't deal with depression, so I don't need St. John's wort and stuff like that. But some people say it's great, some people say it's not. But it's actually, the effectiveness is also determined by, one, is it good for you? And two, there are seasonal considerations. So it's more for like seasonal affective disorder, more than just like annual. So that's, like there are so many considerations to make. So
it's actually more thought for the winter because you have the sun in the winter when it's missing, because here, especially in the northern hemisphere,
it's absorbing the solar energy. Exactly. Yeah.
Here in Switzerland or in the northern hemisphere, we have, for example, very cold winters. We have snow. Sometimes it gets even minus below zero, and so forth. And believe me, you get depressed because it's gray. The sky is gray. Everything is gray. So that's why if you want to get a little bit better in the mood, you can take St. John's wort. Just a few drops and that's it. Not in the summer because you don't need it in the summer. You have enough vitamin D. If you're outside, you don't need vitamin D. It's actually a hormone, not even a vitamin.
Our body produces it through the sun. Yeah.
I'm just saying. And so there's so many different things that you could consider. Don't take too much because you don't need a lot of things. But the one that you need, even for the pets, is exactly the one that you need you to take now and not in a month's time.
Yeah. So yeah, definitely check this out. I'll put all of the information. Maria has a YouTube channel. I'll put her email on there too. You can contact her directly. We will have all of our information with AstroMedic Insights if you're interested in our combined medical astrology reading services or our monthly calls and stuff in the personalized reading, which, by the way, Maria also does offer for pets as well, medical astrology reading. It's very similar to the human reading, but it's basically, she breaks down like what your predisposed health issues are, the supplements, the foods that you can take, the emotional, psychological, spiritual root causes and stuff. It's extremely comprehensive. It's extremely organized. It's really detailed. But unfortunately, a lot of people, when they're having health issues, there is a root cause that's emotional, spiritual, psychological in nature, and our nervous system gets attached to what's familiar. So as clear as Maria's information is, sometimes it's hard for people to take that first step. So I combine my reading with the personal, with the human readings, not for the pets, where I don't even know how to help you with the pets, you guys. But like I layer on emotional, psychological, spiritual root causes and steps that you can take that's going to be sustainable and realistic, that works with your energy level, your lifestyle, the environment that's optimal for you. Some people are going to do better starting something on a certain day, doing it themselves, doing it in a group, you know, all these different things. We do combine it in the Honestly, if you're interested in pet care, I recommend that go visit her, do the pet scan and do a medical astrology reading on the pets. This is going to be extremely insightful. These are things that Maria is phenomenal at. And like I said, when you go there, ask her about the supplements and the tinctures. I promise you, I'm over here speaking for Maria, but I know what I'm talking about. She will literally start talking and you'll get a free medical lesson, because she is incapable of talking about something and not teaching you something. It's going to be it's going to be really fascinating. You're going to learn so much.
Thank you, Jaymie. I have to laugh about it. I never thought that way, but I have to add, you are, I told you before, as a not only metaphor, because you go very, very, very deep when you analyze something. So you are the astrological surgeon. For me, you're the astrological surgeon, okay? Because you take everything apart, all these layers, you uncover them with the scalpel, put it this way, and you want to understand what is really the cause, or the root cause, and that's why I see you as an astrology surgeon.
Thank you. And that's coming from a surgeon, you guys. So when she told me that, I was like, oh my God. And I don't have a surgical background, so I didn't think about it, but I was like, actually, that makes a lot of sense. And the reason why Maria and I connected is that she really appreciated that I go to the root cause of things, because that's something a lot of people don't do. And we are obsessed with that. We're the type of people, we're very all or nothing. So we go hard. If we can't go to the root cause, we're like, it's almost like we're like, why are we wasting our time? Like it doesn't make sense, you know?
It doesn't make, I don't like the shallow, superficial stuff either. And anyway, the client that if it's for the pet or not, if we are on the same wavelength, in the same energy field, they will get us anyway, because I don't want to waste my time to try to explain some other kind of individuals what it does, why, how it does it, and why 50 times, and they still try to boycott whatever your intentions are to help, because finally it's getting, I want to help you or your pet, regardless if you are a human or a pet. And I don't waste my time anymore for that. I want to use the energy for something that is fruitful, that is helping others.
Yeah,
that is my aim.
Yeah, this is really to say that Maria and we get to the root of the problem, that it makes it virtually impossible for you to deny the truth, because when you don't know what the problem is, it's easy to not have to face it. But Maria and we make it irrefutable, because we're like, this is the problem, this is why, this is what works, here's some challenges that could show up, here are some ways to redirect it. And so we're very clear. And if you have questions because you don't understand something, Maria is really receptive. But if you have a resistance to learning, and that's what, like, Maria's not going to sit there and continue to educate you. She does such an effective job with the reading itself, the consultation, that you don't have to ask questions. The answers are there. Not only is it there, but it's organized in such a clear way. It's not overwhelming. And so you really have those tools in this resource. So this is to say that anyone is welcome to get our services, but the people that we're most going to support are the ones that are going to benefit from this, especially with your pets. With personal readings about us, it's a little bit different. There's a little bit more of like a lifetime thing to it. We try to make it as timeless as possible to a degree. Like there's going to be transits that make certain things a greater risk, certain things you're going to have a greater risk as you get older, but you do have, as humans, a larger window basically to use it. But with pets, like it is more of an immediacy, because their mortality is also shorter as well. So this is something to keep in mind. But this is really to say that, like, we are committed to helping people who are ready to make that change. If you're not as ready to make the change with, like, as a human, our personal consultations is going to have a longer window of time, just because of the nature of how long we live for. But the people who are most going to benefit are the ones that are ready to take this action and stuff. We make it really easy for you, and it's something that we're really committed to. We're not going to give you information that's going to waste your time, basically, and buy time. It's not like you know, like Maria said, like she's not really in the health industry, she's in the sickness industry, unfortunately. That's the reality of the matter, you know, but that's not how she's operating out of. So it's not like she's going to ask you for a monthly membership and you need to keep paying for things. It's a one and done, not a one and done, you know, like, but it's like it, you know, you get to the root of it. That's really to say that.
I don't like the ones that rip off people. I can't stand it. It's below. I mean, my brain doesn't grasp it, and is anyway deplorable. Put it this way. Or the one, the scammers and this and that. Nowadays, you have to be careful everywhere you go. And I mean, this is not. I don't have time to be as it's also not my nature. If you need my help and if I can help you, that's fine. But I would never ask, well, you have to this subscription or you have to do this and the other. If you want, it's up to you. If you feel like it, please go ahead. If not, then leave it.
Yeah.
That's it.
Yeah.
Very simple. I mean, we try to give so much information that you can also don't find sometimes in the books, because it's a lot of life experiences as well. If it's for the pet, if it's for the human. I mean, I have enough as well for human. Of course, I work as an emergency or in the ER, and then you have a different approach. But I want really with this machine, with this service, to help dog owners, and even if it's a cat, but I want that the pet has a voice. This is my aim. I adore my pets. Even if it's not mine, I don't want that they suffer, because I have seen so much suffering, and I suffered myself enough.
So I have a question, because I've seen the harness, but obviously it fits dogs of all sizes, cats, but does it also, I'm assuming it's small enough, will it also read like rabbits? But then like, what about hamsters that are a lot smaller, or like guinea pigs?
I mean, this is actually thought for cats and dogs.
Okay,
I could do it even if it's a hamster, but it's just tiny. You can adjust it. I use of course because it's to actually penetrate through the fur. I need it's the gel that I use for the ultrasound.
Okay, so you guys, this is for dogs, cats, rabbits, guinea pigs, pets even as small as hamsters. So all the animals in between. Got it. Yeah. And it literally looks like, if you guys have ever used a body harness on a dog to walk them, that's what it looks like. It just slips in. It's completely painless and stuff. And Maria's also really great with pets. Pets also really love her. Her home, I haven't been there, but I'm a Cancer, so assume I know what I'm talking about, you guys. Her home is very pet friendly. Pets love it there. So just to let you guys know, this is something, it's such an amazing service. If this is something that you're looking for, please check it out. I know a lot of people don't travel with their pets, but if you, I've been a pet sitter, and so many people travel to Europe. They have their annual trips and stuff, and they always have me watch the pets. But if your pet is having issues, take them with you. Like, you'll learn so much. Like, it's going to be incredible.
Or as well, I wanted to add on this, Jaymie. If they have, for example, from the vet, say they have a test result, because this has happened to me so many times, even to humans. They get a test results, they get a report, but nobody translates it for them. They have no clue what is written there. They have no clue. They don't understand the medical terminology. So what do I have finally? What is it? So if they have, for example, they can't visit me, but I would as well give them tips if they would send me, for example, the test results to figure out what the root cause would be.
Absolutely. And Maria knows all of this. She can help you to translate it. And that's true, because as an American, I noticed that like we have a lot of like restrictions with our health stuff. And yet the US has so many different tests available. Like, I know Canadian doctors that have to go to the US to get certain lab results and whatnot, because the US wants to make all this money. So the doctors literally have access to all these tests, and they don't even know what it's about because they don't actually get training on what the tests are. Other countries, those doctors get the tests training and stuff. So I'll go to my doctor and be like, I want this test. And she's like, well, do you have someone that'll analyze it? Because I don't know how to analyze it, which is really sad, you guys. So it's really, really upsetting. So Maria, she's been around for a long time. She speaks multiple languages. So like her training is just very extensive. Like I've known doctors from different countries. I'm a former medical researcher, and it's so interesting. At different generations, there are some doctors that are really knowledgeable, some doctors where they weren't knowledgeable, and then there was an upswing on the knowledge and then a downswing. So the amount of things that people know is largely contingent on when they became doctors. So Maria just became a doctor at such a good time throughout history. So.
I am not 25 years old. Never mind. No, not at all. I'm just saying, if I could help in the sense of translating their test results, because I said sometimes you get a report and you have no clue. But actually, would be the job of the doctor to explain what it means, and what, yes, we have a diagnosis, prognosis, what could be the outcome. That is the job of a doctor, okay, to explain that to you. But most of the time you just get a report and you have zero clue what it means.
And then sometimes, sadly, they don't even know the answer. Like when I broke my foot in my ortho, I was like, well, what are these results? And they're like, oh, you're calcium deficient, have some calcium. I'm like, how much? He's like, whatever the bottle says should be fine. And I was like,
huh?
I shit you not. I shit you not. He said, whatever the bottle says should be fine. And I was like,
you don't need only calcium. You need for at least 12 collagen.
And when you have a vitamin D deficiency, you generally have a vitamin A deficiency. There's so many different things. But like, it was, I was like, I need to get out of here. I was like, I got a mouth on me.
Yeah. But I would have given you as well collagen, because collagen is
I did have collagen.
Because you have deficiency, you have as well that deficiency. That means otherwise you wouldn't have broken your foot or whatever.
And I also had a ligament tear, so the collagen, you know, like it was so many different things. Oh my God! But that's
no. I'm just saying this should be actually our job is to show you, because I usually talk to my patients with pictures. They understand it better. Okay, I show them what's wrong. There's this and this and this is not working properly. I even have it actually here, just for an example. When I say these are the capillary veins, for example.
Oh my God! I love that. Why have you never shown me those note cards? I'm so jealous.
Respiratory system. I'm just saying. I work with that with my patient. I say, listen, this is wrong. We have to act here immediately, otherwise we will get, say, pneumonia. If you carry on like this, you will really get in trouble. Okay, so I show them the pictures, and they understand them better. What is wrong? I say, you have the choice. You decide. It's your body. It's your health. I would suggest this, this, and this, and some lifestyle changes that would be necessary. And then they usually understand what I want to tell them. This is written in your report. What I'm showing you here as a picture.
Oh, that makes me want to get a pet report just for the pictures. I don't even have a pet.
No, but this is this is for the humans, as I said. But believe me, it's not much different for our pets, because for our pets I have even the trigger points where, because I do acupressure as well for the pets. I do it every day with Aurora. I was doing it every day with Tosca as well, and they need it. They love it.
Yeah, and just for reference, in anthropology class, we were told, and I don't remember what it is, so I'm Googling it. How genetically similar are we to fruit flies? I think it was something like we are fruit flies are 60% or 60%. Fruit flies are 60% similar to humans. For context, fruit flies look nothing like us, you guys. Okay, so pets, there's not this huge jump and this huge leap. And so much of what's disconnected and problematic with the healthcare system is that we are separating ourselves from the basics. That ancestral wisdom is so important. And from what you've told me, like, it's not just like what you learned in medical school, but also your family and what your grandmother did. You know, you have a lot of that like ancestral lineage wisdom as well.
I have learned from my grandfather a lot, for example, when it comes to pets, because I grew up with dogs, chickens, and rabbits, you name it, a sheep, to have goats. So I grew up with pets, and my huge love is for dogs. This is like they are my big love in this incarnation.
Yeah.
Perhaps in the previous one I had cats, because I attract even cats, even if I don't have one, but they always come to me. But with dogs, there is such an intricate, deep love. It's my soulmate, put it this way.
Aww. Yes.
Yeah.
So you guys definitely contact Maria. This is absolutely amazing. Thank you so much for watching. And just a little bit of an announcement for medical astrology. Maria and we're going to start doing webinars on specific health topics. So if you guys want to leave us comments below with specific topics that you want us to do courses on, let us know. So far, you know, we're going to do multiple ones, but like we've talked about doing one for cancer, diabetes, endometriosis, or like the reproductive health, but we want to hear what are some things that you want to learn about. So be sure to comment below and let us know.
Thank you.
Yeah. Is there anything else you want to add, or?
No, I hope that, you know, that these animals, these pets, they have longevity, that they stay healthy as much as possible. If they need whatever help, and if I can help, then they're very welcome, because really we should give them more a voice for them. Okay.
Absolutely. Thank you so much, you guys, for watching, and we'll see you guys soon. Bye.
Bye-bye. Bye.